Obesity remains a very serious chronic disease that affects more than 40% of America's population. Pennington Biomedical Research Center has identified it as a public health issue in Louisiana. And here to talk about the latest stats is Joe Nadglowski, President and CEO of the Obesity Action Coalition. Thank you so much for joining us this morning. So let's start off first with ironing out the details about how many people in Louisiana are affected with obesity.
So Louisiana stats look just like the national stats, right? About 39% of people in Louisiana live with obesity. And I'll be frank here, it's probably an underestimate because how we actually measure that is we call people and we ask you how much you weigh and how tall you are. And let's be honest with you, most of us are not particularly honest about that, right? We're a few inches taller or a few pounds less. So probably those numbers are even higher than that. We're probably in the mid-40s in terms of percentage of people living with obesity.
So as far as locations in Louisiana where you see it the most, is there any place that sticks out to you?
So I think it's a problem all across the board, but we actually find that obesity is often worse in rural communities versus in the city environment. So we actually see higher rates among those people who live in these rural communities. Now, why that is, not 100% sure. We're waiting for the data to tell us why that is, but it's a trend we actually see nationwide.
So it's obviously dangerous to be overweight, but I mean, are there any other health risks that are associated with it?
Yeah, so obesity is definitely not just about your body size, right? There are plenty of people who can live in a larger body and be healthy. Obesity is really when you live in a larger body and it starts to impact your health. And the health things that can be impacted is you have a greater risk for diabetes, heart disease, cancer. You name the condition. There's actually about 250 conditions associated with obesity. Now, obesity isn't blamed for every health condition, but the reality is it does cause many of the health conditions that affect people.
Wow. Okay, so 250 other conditions that are linked to this. And of course, you mentioned diabetes, heart disease, which are things that pop up a lot here in Louisiana. Are there any demographics that are affected more than others besides people that are in rural communities?
Yeah, so I think for sure when we look at the data, people of color have higher obesity rates, especially African American women who struggle with obesity higher. Now, part of that we have to acknowledge could be a flaw in how we measure obesity, which is through body mass index. But the reality is we see higher rates of diabetes, for example, in black women as well, right, kind of thing. So it is important to recognize, especially if you're in those demographics, that you should actually talk to your doctor about how your body weight is impacting your health. Because I want to be very, very clear. Not everyone who lives in a bigger body has obesity, right? Because their extra body fat may not be affecting their health. But if it is, you need to talk to your doctor about it and work on a plan to get as healthy as possible.
So we talked a little bit more about this before we started filming, but having obesity or people that live with obesity, it kind of affects the community as a whole. Can you tell me a little bit more about that?
So it's important to recognize that obesity impacts people's life, not just from the health perspective, but the entirety of their lives.
Yeah, it's a stigma that they're really dealing with.
Absolutely. So weight bias and stigma arguably is the most challenging thing to live with when you have obesity. Somehow when we made obesity bad as a world, as a society, as a nation, we made the people who live with obesity bad as well. And that's a big problem, right? With other conditions, with other diseases, we're very clear, cancer is bad, but we have compassion and empathy for people with cancer. But somehow with obesity, we don't do that, right? We have this tendency to blame and shame people. And I'll be honest with you, it's that blame and shame that actually keeps us as a society from doing something to address obesity.
Right, and I've noticed, throughout this entire interview, you've not said that a person has obesity, they live with it, and that's part of addressing the stigma.
Absolutely. So, again, we are more than just our condition. So the word you hear often used by people is the word obese, and I would encourage people not to use that word. We wouldn't say someone's cancerous, right? They live with obesity, they live with cancer. Let's treat this condition with the respect it deserves, and all we're asking for is a little compassion and respect around it.
All right, so in your opinion, how do you improve these statistics in Louisiana?
Yeah, so I think the real challenge here in Louisiana is, if you woke up today or you're watching this today and you say, you know what, I want to do something about my obesity, and you go to talk to your healthcare provider about it, it's likely that the options you have are limited. We actually do not have access to care for many people who live with obesity. They may want to, again, seek behavioral therapy, medical therapy, surgical therapy, but oftentimes their insurance will exclude those kind of coverages. So that's one of the things we're working very hard here in Louisiana to do, is actually improve access to those therapies. We also then have to recognize as we have to make systems changes. We have to change the food environment. We have to make the healthy option the easy option, right, kind of thing. We can't continue to live in an environment where it's just too easy to eat unhealthy foods. It's going to take this combination combination of both preventing obesity and treating obesity to make a real difference.
Preventing and treating.
Right. Can't do one without the other. We need both of them together. So.
All right. Well, thank you so much for coming in. I appreciate you talking to us about this.
Thanks for having me.